Hi, my name is Connor, and tonight on 60 Minutes we will be discussing an incurable disease, chronic obstructive pulmonary disease, or COPD. Tonight we're going to be discussing the symptom severity and its significance. We will also be taking a look at the life of a patient with this disease. Chronic obstructive pulmonary disease is a condition characterized by persistent respiratory symptoms and airflow limitation. 16 million Americans are currently diagnosed with COPD, and 150,000 of them will die this year, making it the fourth leading cause of death in the United States. COPD is caused by airway or lung abnormalities, usually caused by exposure to harmful gases, such as those produced from tobacco smoke. Individuals suffering from COPD often experience shortness of breath, wheezing, cough, and fatigue, making a life with COPD difficult to handle. Patients often have limited physical activity, and it eventually impacts a person's ability to perform everyday functions, which we will see with our guest tonight, Kavitha, a 75-year-old who lives with this debilitating disease.
At a certain point, COPD was running my life. Everything I did on a daily basis was affected by my shortness of breath. And every day, what I decided to do was based on my COPD, and I found myself becoming very limited in the things that I could do.
Kavitha Copter currently lives in Shady Oaks Retirement Village in Florida and is a retired lawyer. She was diagnosed with COPD at the age of 55 and has lived with chronic symptoms ever since. She was a smoker for 30 years but quit at the age of 60 after she was diagnosed with chronic obstructive pulmonary disease.
So how have the treatments helped you?
So initially they helped me a lot, and the few times I have used my rescue inhaler, it worked really well. And my maintenance inhaler did help me feel better. However, I still found myself having shortness of breath. And I've had therapies added and changed over the years, but currently I still have shortness of breath, and I'm unable to do any exercise, and I often have a cough. I have routine appointments with my doctors in order to check in on how I'm doing and just seeing if my medications are working. But I actually have an appointment coming up in about a month.
What about your overall quality of life? How has this condition affected the way that you live?
So it becomes part of your lifestyle, and at a certain point, your breathing becomes your central focus of the day. It's the number one factor that goes into what you can plan for the day, and because you don't want to plan something that will leave you unable to breathe right. Being that I cannot do much physically, I don't leave the house as often as I used to, and it's really sad as I miss out on family events and I don't get to see my grandchildren as much as I would like to.
To get a professional insight on the disease, we talked to Dr. Sophie Saba, an expert pulmonologist at the Mayo Clinic in Worcester, Minnesota.
COPD is caused by damage to a person's airways and/or the small sacs in the lung that are responsible for gas exchange, and therefore the exchange of oxygen from the air that we breathe into the body. Symptoms can start out minor, such as a cough, but then progress into great difficulty breathing, and the damage that COPD causes cannot be undone.
So, what are the current treatments for COPD?
The main treatment for COPD is bronchodilator inhalers. These include short or long-acting beta-adrenergics or anticholinergics. Short-acting inhalers are used in the case of exacerbation when you need relief right away. Long-acting is your maintenance therapy. Beta-adrenergics work by dilating the airways by relaxing the airway muscles. Anticholinergics work in the nervous system to prevent airway constriction from happening in the first place.
How have the available treatments affected the COPD community?
Essentially, they improve a patient's ability to breathe. Overall, the use of bronchodilators decreases COPD exacerbations and hospitalizations and increases patient overall quality of life. However, there is still no cure. The current emphasis in the medical community for currently diagnosed patients is focused around educating them on the disease and the proper way to take their medications. I personally believe that the true emphasis for this disease should be placed more toward prevention due to the fact that this is a preventable disease.
So you just mentioned prevention. What can people do to prevent COPD?
Tobacco smoking is the main cause of COPD. It can also be caused by air pollution in homes or in the workplace. COPD can even result from secondhand smoke, but smoking cessation is the main controllable factor that contributes to COPD. And I think that one of the main reasons for the high incidence of COPD is the lack of community education on the topic of how tobacco smoking can lead to serious diseases such as COPD.
We had hoped to follow up with Kavitha following her doctor's appointment to see if her symptoms had improved at all. However, upon reaching out, we were made aware that before her appointment, she had an exacerbation of her COPD, and unfortunately, she passed away before she could receive proper treatment at the hospital. We spoke with Lisa Lama, a dear friend of Kavitha's, and she tells us that they spent nearly every day together.
Kavitha and I were neighbors at the Shady Oak Village retirement village. She lived across the street from me, and every day I would go see her since she wasn't able to leave her house most of the time without running out of breath. So I figured it would be easy for me to just walk over to her house, and that would save her the trouble. She was my chess mate, working partner, and we watched movies together. We were really good friends.
This has got to be really heartbreaking for you. What has been the hardest part for you during all of this?
I think it's the fact that this could have been prevented if she didn't had decided to become a smoker and smoke for so long as she did. She may have never gotten COPD and had a better quality of life. She may even still have been here with us.
This case was a tragedy. As you can see, COPD not only affects the patients, but also those that surround and support them. It is a preventable disease with a high rate of mortality, contributing to more deaths per year than it should. Our hearts and prayers go out to the Copter family in this trying time. Thank you for joining us, and see you next time on 60 Minutes.